Hi, good day. My name is Alize Lyons, and today I'll be doing a presentation on pharmacology. We'll be talking about 5 medication that is used by EMTs. The 5 medications are nitroglycerin, aspirin, oxygen, oral glucose, and EpiPen. We will be talking about their indications, contraindications, side effects, their dosage, and the route they are administered. First, I would want to tell you what is pharmacology. Pharmacology is the study of drug and the effect that it have on the body, right? In this discussion, I will start by talking about nitroglycerin. Nitroglycerin, otherwise called nitrostat. The indication for nitroglycerin is patient who presents with chest pain, patient have heart failure, patient who have hypertension, hypotension, sorry. Contraindication for nitroglycerin now, you would have, if them have an allergic reaction to it, myocardial infarction, otherwise called MI, hypersensitivity, and patient who take Viagra within the last 24 hours, right? The side effect for nitroglycerin is them have a headache. The patient blood pressure would have drop, right? So they would have a drop in the blood pressure. Patient would have side effect would have be lightheadedness, right? The patient also would have weakness, and the patient would have be tachycardia. The route for nitroglycerin is sublingually under the tongue or a spray, right? The sublingually, it can be a tablet or the spray. You can use it also, you can give it through IV and through IV transdermal, that are either you put on one patch or you put on a paste, or you can give rectal, that are with an ointment, right? The dose of nitroglycerin is 0.3 to 0.4 milligram or 1 or 2 spray out of the spray container. And you repeat that every 5 minutes. You can give up to 3 dosage within 15 minutes. The next thing we'll talk about is aspirin. Most of these medications have the same indication, contraindication, side effects, and so forth. Aspirin. Aspirin also, indication for aspirin is also chest pain. Also, if somebody have overall pain, they might feel pain all over their body, they might have muscle pain, they have headache, and another indication is blood thinner, right? The contraindication for aspirin is hypersensitivity, they have a bleeding disorder, they have GI bleeding, they have liver and kidney disease, right? The route to take aspirin is orally. You can use a tablet or you can use chewables, right? The side effect for aspirin would be if them have heavy bleeding, like GI bleeding. Also, if them allergic to aspirin, or if they have a skin reaction, like their skin bump up or swell up or so. The dosage for aspirin is 160 to 325 milligram. The next one we'll talk about is oxygen. So, say indication for oxygen is hypoxia. Also, if the person have difficulty breathing, like the person asthmatic, them have shortness of breath, them in a respiratory distress, or so anything if you do with the airway, right? Contraindication for patient who take aspirin, COPD patient, babies were premature, right? The side effect for oxygen. Now, oxygen, now we give oxygen like when the person have decreased responsiveness, right? If a person have a nosebleed, and also we can give oxygen. The side effects for oxygen is that them are unable to tolerate the mask. So the mask now it go over the mouth and the nose or into the two nostril. The route for oxygen is inhalation. So with inhalation is either you use a nasal cannula or you use a non-rebreather mask. And the dosage for oxygen is 1 to 6 liters for the nasal cannula and 7 to 15 liters for the non-rebreather mask, right? Next thing we talk about is next one is oral glucose. Oral glucose, the indication for oral glucose is hypovolemia. The patient, if they have seizure and if they have altered mental status. The contraindication for oral glucose is if the patient is unresponsive and if the patient is unable to swallow. So that means then tongue swell up or something affect the airway. The side effect for oral glucose is them allergic to it. They have an allergic reaction. They start have stomach cramps and they start have diarrhea. It's the route for oral glucose is orally. You can put it as a paste and put it to the jaw. The dosage for oral glucose you give like half tube to 1 tube or 0.5 7.5 gram to 15 gram. The final one we have now is EpiPen, otherwise called epinephrine. Epinephrine is anaphylaxis, means them have an allergic reaction, right? Also the indication for epinephrine is hypotension from septic shock. So if a person develops septic shock, that our indication too. A contraindication for EpiPen is known allergies, right? Like also if suppose them get a bee sting, them can allergic to pollen, not allergic, contraindication, pollen, food, medication, or patient who have a cardiac arrhythmia, right? The side effect for epinephrine, the patient can be tachycardic, the patient can be hypertensive, they can get restless, and they have anxiety, means they are gone. You understand? Also, they can have cerebral hemorrhage that can lead to, that is a stroke. It's the road for epinephrine is intramuscular, so to the side of the thigh, and after you massage it in. The dosage for epinephrine is 0.3 milligram for adult and 0.15 milligram for child. That concludes my presentation on pharmacology. Thank you.